All right. Good afternoon, everyone. My name is Kara. I'm the orthopedic nurse navigator here at North Kansas City. I have been in orthopedics for most of my nursing career, starting about 10 years ago. And now I primarily work with our total joint replacement patients, so patients receiving total hip and total knee replacements. So today we're going to be talking about arthritis and things you can do to kind of get through arthritis in the winter, as well as general treatments for arthritis. So first, we'll just talk about generally what arthritis is. So arthritis is inflammation in one or more of the body's joints that causes pain and stiffness. And this is most common in our weight-bearing joints. So if you think about the joints in our bodies that bear the most weight, those are our knees, hips, and spine. And that is where kind of this osteoarthritis, which is what I'll be primarily talking today about, is at. So there are several different types of arthritis. Osteoarthritis is kind of your general wear and tear type of arthritis. Inflammatory arthritis is an excessive inflammatory response, and the most common type of arthritis in this category is rheumatoid arthritis, and it affects both large and small joints. There's post-traumatic arthritis, which essentially results from an injury to the joint from trauma. So this could be a sports injury, a car accident, something like that. The cartilage in your joint becomes damaged and can cause additional friction, and over time that joint breaks down more quickly. And then there's septic arthritis or infectious arthritis. Typically, this happens after an infection in another part of your body, and your joint will become acutely or suddenly warm, red, and tender, and you will often run a fever with that, and that's a reason to talk to your doctor. So 1 in 4 people will experience some form of arthritis, and of those, over half will be experiencing osteoarthritis, or that wear and tear type of arthritis. So that's what we're going to be primarily discussing today. So again, this is the most common type of arthritis. And on the screen here, you'll see 2 images. They're both of a knee joint. So the left image is a normal knee joint, and on the right is an image of an arthritic knee joint. So I'll kind of talk about some of the key differences in these images. So you'll see that this is pointing to articular cartilage. So that just means cartilage in your joint, and all of your joints you'll find have this cartilage that covers your bones and kind of keeps a nice smooth moving space for your joints essentially. In the meniscus, this is specific to the knee. It's another part of cartilage that again allows that nice smooth moving space. And then there you'll notice that there's a space there in that joint. On the arthritic joint over on the right side, you'll notice that it's pointing out cartilage loss. So over time with wear and tear, that cartilage starts to break down, and you'll see that the bone is kind of showing through. It looks jagged in places, and then there's bone spurs. So essentially what happens with bone spurs is they develop after a loss of cartilage or an injury to the bone, and basically it's the bone attempting to repair itself and repair that cartilage loss. You'll also see joint space narrowing with arthritis, and this is related to often loss of cartilage in those joints. So, what is wear and tear? So again, in those weight-bearing joints, they just go through wear and tear just with our everyday movement. Overuse is a cause of additional wear and tear. So if you're someone who's like an avid runner or actively in a lot of sports, that can be kind of cause of that overuse. As I mentioned earlier, trauma is a potential cause of that breakdown of the joint, causing that cartilage to get kind of broken off a little bit. It causes additional friction in that joint, which causes that cartilage to break down quicker. And then there's just general natural degeneration with aging. Common symptoms of arthritis. So one of the most common and classic symptoms of arthritis is stiffness, and most people will talk about this with their arthritis. So often people experience this mostly when they're waking up in the morning, after they've been sitting at their desk for a while maybe, or after long car rides. So that's that kind of stiffness or difficulty moving after that time of inactivity. Swelling can be common in other types of arthritis. In osteoarthritis, it can happen, but if it lasts for, more than 2 or 3 days, or if it happens more than just a couple of times a month, that's a reason you should talk to your doctor and let them know that you're having that swelling in that joint. So when I talk about symptoms of movement, I'm talking about difficulty moving your joint, kind of beyond that stiffness that you may experience with arthritis. So this is essentially your range of motion is limited in your joint. So maybe not being able to straighten that joint out fully or bend it fully. Pain is another common symptom of arthritis, and it can vary from person to person how that is experienced. So some people say that it comes and goes. Some people say that it's constant, maybe more prevalent with certain people after, again, rest, sitting for a long time, or it might be more prevalent with walking and activity. The important thing is that, as you experience your pain, you want to make sure you're mindful of that and letting your doctor know what type of pain you're experiencing, because they can guide your treatment based on the type of pain that you're having and experiencing, and that will be best for, getting pain relief. A grating feeling or noise is often associated with arthritis, and this is typically caused by joint roughness on the surface of the joint. So if you think back to that previous image of that cartilage breaking down and becoming rough, that can cause that grating feeling or noise. Sometimes patients or people will talk about locking or sticking in the joints, and that is often caused by kind of loose pieces of cartilage in the joint after being broken down. So I'm going to talk about common treatments and ways you can help improve your arthritis. So we'll be talking about lifestyle changes. I have a full slide dedicated to this coming up. Medications, I again have a full slide dedicated to this coming up, so we'll dive more into those in just a couple of minutes. Physical therapy may be recommended by your doctor depending on the progression of your arthritis. So again, this is something that is ordered by your doctor, and these are specific exercises that are given to you at the direction of a physical therapist. These can help with range of motion and strengthening the muscles around your joint, and can help with pain and range of motion. Assistive devices or braces. So when I talk about assistive devices, I'm talking about canes or walkers, and those might be recommended by your doctor. And what these will do is help, one, if you're at a risk for falling, they'll help prevent further injury to that arthritic joint. And also they'll help take pressure off of that joint. So you'll hear me a lot throughout the day talking about taking pressure off of those joints because that is going to help with pain. Braces may be recommended by your doctor as well. So some braces can help take that pressure off of the joint and help with pain. Other braces will help kind of make that joint feel a little bit more supported. Surgery is another treatment for arthritis. And typically when I talk about surgery, I'm talking about like a total joint replacement, total hip, total knee replacement. And this is typically the last line treatment. So it's after you've done all of these things above and they haven't helped with your pain or your functional ability to do things at home. So after doing all of these things above at the direction of your doctor, then they may recommend a total joint replacement if that's necessary for you with arthritis. All right. So lifestyle changes, the best lifestyle changes you can make are exercising. Regular exercise can help decrease the stiffness in your joints and strengthen your muscles. Strengthening those muscles around those joints will help, again, take pressure off of those joints and help with pain. Also, whenever you exercise, you increase your blood flow, making sure you're getting plenty of blood flow to that cartilage, helping make sure it gets the nutrients it needs to stay healthy. So this is especially important in early stages of arthritis to kind of slow that progression. Low impact exercises are a better option for patients with arthritis most of the time, just because it kind of decreases the pressure on those joints, decreases the impact on those, and can kind of slow down that progression and decrease that progression of the arthritis. So low impact exercises are things like walking, cycling, or swimming. If it's been a while since you've exercised, you want to make sure you start slow with a goal of maybe 20 to 30 minutes of aerobic activity 3 or 4 times a week. So even just doing, 10 minutes of walking in the morning and 10 minutes of walking in the evening is really a great idea to kind of increase that activity. Warm water therapy or exercise is a great option for people with arthritis. So whenever you get in water, you're kind of naturally buoyant and it helps take that pressure again off of those joints. And often people with arthritis find that warm water very soothing for their joints, kind of makes that movement feel a little bit easier. So exercise in the water can range from swimming to even just getting in the pool and walking laps. So there's a lot of opportunity there. Weight loss is something that can be helpful for pain because it helps take the pressure off your joints. So talk to your provider if weight loss is recommended for you. It's something that you can consider to help take the pressure off of those joints. So as you lose weight, every pound you lose is about 3 to 4 pounds of pressure off your joints. So if you lose even 10 pounds, that's 30 to 40 pounds of pressure off your joint. That can really help with pain. So I have on the screen here some information about our fitness center here at North Kansas City Hospital. So the link that's listed, the nkch.org/joint or /class, I'm sorry, is I'm going to pull up this page that's kind of on the screen here. And this is all of the classes that are offered through North Kansas City Hospital and Meritas Health. So on the right side, whenever you pull up this screen, you can click the specific things that you're interested in, and it will give you like options for dates and times of classes. So at the very bottom, you'll see there's warm water exercise and water exercise. In the middle, there's land exercise as well, if that is more what you're interested in. So this is a great resource for, again, if you have arthritis and are looking to get active or want to try out water exercise. Excellent resource. If you have specific questions, you can call the phone number on the screen. Also, whenever you click into these classes, they have a phone number attached to them as well that you can call. If you're not close to North Kansas City Hospital and are looking to get into like water classes or low impact exercises, YMCAs often have pools and have classes available, so that could be a resource you could look into. Other community centers may have options for pools or low impact exercises, so you can always call and ask about those low impact exercise classes or programs that you may be able to utilize to help get more active. All right, so medications. So Tylenol is a very common medication that's used to treat arthritis. It's just a pain reliever that you can get over the counter. Most people have used or heard of this. And these are medications, so especially Tylenol and then the over-the-counter anti-inflammatories like ibuprofen or Aleve. These are very common for people to use just, oh, my knee hurts or my hip hurts. So they take either Tylenol or ibuprofen to help with some of that pain. And these are perfect for that arthritis pain. Anti-inflammatory, so the over-the-counter options are typically NSAIDs or non-steroidal anti-inflammatories. And I do like to just say that these should be avoided in some health conditions like kidney disease or heart failure. If you have those and are considering taking these, or you are taking these and haven't talked to your doctor about it, I would recommend talking to your doctor and just making sure that those are safe for you to be taking. But for the most part, people can take these without any issue. There are also topical anti-inflammatories. So you may have heard of them. It's called like diclofenac or Voltaren gel. Often these can be purchased over the counter. There are also some that can be made in pharmacy that are a prescription strength. So these are nice because you can take this and apply this gel or this cream directly to the joint that's affected. So if it's your left knee that hurts the most, you can put this gel on that joint specifically, and it usually helps with pain pretty quickly for people. I do like to say that you shouldn't take this with oral anti-inflammatories or medications you take by mouth that are anti-inflammatories unless it's at the direction of your doctor, because as you put that on your joint, it can be absorbed into your bloodstream through your skin. So just again, making sure that you're talking with your doctor about all of the medications that you're taking. There are some prescription anti-inflammatories that you can take as well. So these include medications like Celebrex and Mobic. Again, these are typically prescribed by your doctor, typically only taken once a day, and you typically should not combine these with over-the-counter anti-inflammatory medication. So again, making sure you're discussing with your doctor any of these medications that you're taking. Often you'll hear of patients with arthritis getting injections. So a common injection is cortisone or a steroid injection. Steroids have very powerful anti-inflammatory effects and can be very, very helpful and last quite a long time for pain relief after you get an injection. Often you'll hear that these are limited to just a few times a year, so you can typically only get them maybe 4 times a year, every 3 months. And that's just due to the potential side effects of those medications. Often when people get these injections, it takes about a week to kick in, a few days to a week to kick in, and then can last for several months. So they can be very helpful. And these are given by your primary doctor or an orthopedic doctor or something like that. So one of the most important things about, you know, treatment of arthritis and maintaining your arthritis in the wintertime is injury prevention. So the last thing that you want to do if you have arthritis is cause an injury in there and cause additional cartilage breakdown, which will increase pain and accelerate that joint breakdown. So avoiding injury is one of the most important things you can do in the wintertime. So obviously, if you can avoid going out in icy conditions, make sure that you do that. Make sure you're using your supportive devices, so canes, walkers, as recommended by your doctor. Make sure you're utilizing supportive shoes with good tread. And if you have to go out in icy conditions, using something like micro spikes, so the bottom picture here on the screen is an example of those micro spikes, and they can be very helpful for maintaining traction and making sure that you don't fall if you have to go out in the icy conditions. Also in the winter time, people often say that, the cold weather makes them feel more stiff and things like that. So bundling up, wearing layers, making sure that you're staying nice and warm can be helpful to kind of decrease some of that stiffness. Using heat if you're experiencing additional stiffness, so putting some heat on your joints for a short time may help loosen up some of that stiffness, and getting into that warm water exercise if you can be very helpful for, again, loosening up those joints and making you feel a little bit more comfortable in the winter time with arthritis. So that essentially concludes kind of my presentation here, but if you have any questions, I am happy to answer those for you.
Kara, I
Yes.
do have a couple questions that have been asked.
Okay.
One of the questions, at what point is surgery appropriate? When do you know it's time for surgery?
Yeah, that is a great question. So often pain is the biggest thing and limiting your functional ability, so not being able to do the things that you're used to doing is what drives people to consider getting a total joint replacement. So, surgery, if you think surgery might be necessary for you, if you're continuing to have pain despite doing some of these things I mentioned, getting a referral to an orthopedic surgeon might be a good option for you. And you can talk to your primary care doctor about getting that referral. You can ask friends and family if they've had, if they've had experience with orthopedic surgeons and find one that way. Here at North Kansas City, we work with several different surgeons' offices, and I am happy to help you kind of get in touch with those offices if you want to give me a call, and I can give everyone my phone number if you'd like to talk about that. So my phone number is 816-691-8282. And typically, whenever you see an orthopedic doctor, they'll go through with you kind of what you've done to treat your arthritis and goes through some different treatment options for you. For example, if you haven't tried, physical therapy, then your orthopedic surgeon may recommend some physical therapy to try that and see if that will help with your pain and increasing your functional ability. And then if not, then they may recommend a joint replacement based on how you're doing after that.
Thank you. And then another question that's here, is it true that rain affects the pain in the joints?
So that is definitely a phenomenon that I hear about is with kind of different changes in weather, people definitely have some increased stiffness in those joints. So again, kind of, looking back at some of these, strategies I talked about earlier, stiffness, especially in joints, you can use heat on, and that often will help people feel a little bit less stiff. But yes, I do hear about that as a phenomenon of people having increased pain and stiffness during those times.
Well, thank you very much for your presentation. Very informative.
Awesome. Thank you so much. Are there any other questions?
I don't see any other questions on the board right now.
All right, perfect.
All right, well, thank you and have a wonderful day, everyone.
All right, thank you, Sandra.
Bye-bye.